welcome back to the Tooth Be Told podcast. My name is Brandy. I am a registered dental hygienist with a local anesthesia permit, and I've been practicing in the dental field for the last 20 years. If this is your first time joining us, our podcast is focused on providing the underserved and underprivileged communities, particularly communities of color, with the resources, the information, and the tools to help improve their dental health care experience. So, I just wanted to talk to you guys today about infections. I have several patients that come in and they are in extreme pain. They have an acute infection, and typically, acute infections have a sudden onset. They start kind of out of nowhere and they last for a short period of time, so like a few days to a few weeks. An example of an acute illness would be like if you were having an asthma attack or if you had a broken bone. In regards to dentistry, an acute infection would be if you had sudden tooth pain, if you had a lot of inflammation in your gums or in the area of a tooth, and you had very severe pain. That started kind of out of nowhere. So that's what I'm talking about. If you're going to your dentist with a sharp pain, something that is pretty new to you. You haven't had any issues with the tooth, but all of a sudden you're having a lot of pain, maybe to hot things, cold things, to chewing, sweet things. And you go there to the dentist and you want the tooth worked on ASAP. Either you want the tooth removed or you want to have, a root canal or need to have a root canal or an extraction. And the dentist looks at you and says, we can't do that today. You need to be on antibiotics. And I just want to kind of explain this because people are uncertain as why these teeth or issues cannot be worked on right away. So the reason why you cannot have work done on teeth or structures inside your mouth that are inflamed or are infected is because the tissue is very acidic when there's any infection present or inflammation present. And the local anesthetics, which is the numbing medicine that we inject into these areas so to make you comfortable during procedures, is very sensitive to pH levels. Also, when you have inflammation, that actually reduces the effectiveness of the numbing medicine. Especially during dental procedures. So, you're not going to be comfortable enough for us to do any kind of procedure. So that infection needs to be dealt with prior to any dental treatment being done. And the way the doctor usually does this is he or she will prescribe a course of antibiotics that you need to take. And so, what a lot of patients do, they make the mistake of taking the antibiotics home, starting to take them, and once they feel better in 2 to 3 days, they stop taking them. So, just want you guys to know that if you are prescribed the antibiotic for an acute infection inside your mouth, associated with a tooth, associated with tissues in your mouth, you have to finish the entire prescription of antibiotics, the full course. And the reason why you need to finish this is because when antibiotics are removed too early from disease causing bacteria, the bacteria may start to grow or multiply, and that causes the infection to return. Also, the bacteria that regrow, they'll likely be resistant to that antibiotic that was initially taken by the patient. So, that means that if you stop taking them and you save them for later and you're like, I'm good, 9 times out of 10, that infection is going to come back. So you want to make sure you finish the antibiotics. Don't leave some for later. And then when you have another issue, you take it for that. It really is not a good thing. It's not going to be helpful for you. So always, always, always finish your full course of antibiotics. Now, if you have a chronic infection, which is something that develops slowly and it may worsen over an extended period of time. So instead of days or weeks, it'll be more like months or years. So a example of, let's say, a chronic disease would be like asthma or osteoporosis. And an example of a chronic infection in dentistry would be like if you had a tooth treated for root canal in the past. So you've had a root canal done on the tooth, and there can be an infection on the root tip of that tooth inside of the jaw that's been there for years. And the manifestation that you see inside your mouth will be a pimple or a bubble right next to that tooth that comes and goes time and time again. It may or may not be painful. It may or may not have discharge associated with it, like pus or blood. But that would be the example of a chronic infection in dentistry. For those infections, sometimes a course of antibiotics is also given, but most likely what needs to be happening is that tooth has to be fixed. It has to be addressed, whatever the issue is. So the interesting thing in dentistry is that when antibiotics are prescribed, they're never to cure you of anything. So like for instance, just say you had some kind of bacterial issue elsewhere in your body, and your doctor gives you antibiotics. Typically, that bacterial issue is going to be gone. After your antibiotics is gone, you're done. You don't never have to have that thing again. Is you're done and done. With dentistry, the only way to cure an acute or chronic infection is to deal with the issue. That could be to remove the tooth, that could be to root canal the tooth, or that can be to do a filling, whatever the case might be. It has to be addressed or it's going to continue to linger and come back. So having said all those things, I just wanted to mention that because I've been having this happens always, but unusually this week, I've been having a good amount of patients who are having this same issue. So, just to reiterate and recap, guys, if you're having an infection inside your mouth, you have to have a course of antibiotics prior to any work being done on that tooth or on those tissues in your mouth. The infection has to be gone so that you can get numb and we can work on you comfortably. And you need to take the full course of antibiotics because you can cause that bacteria to become resistant, to regrow, and that infection will continue to reappear and show itself over and over again. If you guys have any questions, if you have any suggestion for content or how we can improve the podcast, please go to our email at truthbetoldpodcast@gmail.com. You can check out our Instagram page at Truth Be Told Podcast. And of course, you can always go to the website, truthbetoldpodcast.com, and hit us up there. You guys have a fabulous holiday weekend. Take care, and we will see you guys shortly.